We're live.
Kia ora koutou, and welcome everybody to this live vaccination education session. For those of you who I haven't had the opportunity to meet, my name is Josephine Gagan and I'm the Group Chief Executive of New Zealand Health Group. On my right here, I've got Veronica Manion, who is our Group Chief Operating Officer.
Kia ora.
We're also joined with this live session with Professor Siouxie Wiles. Kia ora, Siouxie.
Kia ora.
Siouxie is a well-known microbiologist and scientist and has studied at the University of Edinburgh and followed by a PhD in microbiology. So she's got a wonderful knowledge and experience in this area. And on her left, we've got Hannah, who is our lead vaccinator up in Albany. And she's very kindly agreed to join us here today. So, kia ora, Hannah.
Okay. Thanks for joining, everyone. We thought we'd start today with some of the key questions we've been getting from the sector, and welcome to any people that are staff that are here from other employers. It's great to have you here today. So Siouxie, how what is in the vaccine and why has it been developed so quickly? That's the key questions we're getting.
Yeah, great questions. So maybe I'll start with the how was it developed so quickly. So it's all the vaccines are based on decades of research, but the Pfizer one that we're using here hadn't gone into humans before the pandemic. So that one also is based on decades of research, and in fact there were versions of it as a vaccine for other things that were ready to go into clinical trials. But basically, clinical trials are really, really expensive, and so the money was never invested in that. Whereas when it came to COVID-19, basically a huge amount of investment was put in this place. You know, governments around the world and NGOs around the world put in loads of money. And because this mRNA technology is really quick to make vaccines from, basically they were the first to get into clinical trials. But I just want to spend a couple of minutes, I guess, explaining what the normal process is for getting a medicine or a vaccine into clinical trials and then from clinical trials to humans, and how, to use in people, and then how that's been different with these vaccines. So we normally say that process would take kind of 5 to 15 years of getting through all the trials and everything. And I think when we talk about that, it makes people think that maybe the things are studied for 5 to 15 years, and that's simply not true. Actually, they would be studied for a similar period of time, really, to what they've been studied for at the moment for these vaccines. But instead, there's years spent where nothing much happens at all, and everybody's trying to figure out where the money comes from, right? So under normal circumstances, you have phase 1 trials, which are, these basically first in humans, so looking at safety, but also looking for what an appropriate dose is. And then after those phase 1 trials, there'll usually be a delay while everyone decides, are we going to go for the phase 2? They'll find money for the phase 2, and then they'll move those, whatever that product is, into more people. And then if the phase 2 trials look good, and they're really kind of giving an indication, does the thing actually work? And then if it works in those smaller number of people, then they'll basically decide who's going to pay for the next stage, which is the phase 3, which is much more expensive. And then that's when it will now go into thousands of people. And they're looking not just at how effective something is, but also are there any rarer side effects? And then after all those processes, then there's a period of time where they gather all the information together and they give that to the regulators, and then the regulators look at all that information, so from all the trials, but also all the animal studies, and then decide whether they're going to allow the medicine or vaccine to be authorized. And then after that starts the manufacturing process, and depending on how complicated it is, how difficult it is, that can take time too. So that's sort of where all the time comes from. Lots of it hanging around, waiting, trying to find money, waiting for regulators, or manufacturing the thing. When it came to COVID-19, as I said, so we're in a global pandemic. Countries all around the world just kind of poured money into this area. And so that meant that the trials started really quite fast. And the thing that was, there's been, I think, 3 innovations really that have made things happen so fast in this instance. So the first is that instead of having those trials happen one after the other, they were basically staggered. So they had this staggered start, but then essentially happened simultaneously. So once the phase 1 trials had shown that it was safe and there was a dose that was ready to try, then the trials carried on, but the phase 2 trials were able to start. And then as soon as the phase 2 trials started to look like the vaccine was effective, the phase 2 trials carried on, but the phase 3 trials started. At the same time, all of the data from those trials was given to the regulators under what we call a rolling basis. So rather than waiting till the end and giving them all at once, they started to give the regulators in bits and pieces so they could look at the data as they were going along. And then at the same time, as soon as the vaccines were shown to be safe in those phase 1 trials, manufacturing started. And that meant that by the time the phase 3 trials got to the stage where we knew that they were safe and effective, basically there was vaccine doses ready to hand out already now wider than the clinical trials. And I think one thing that's really important to say is that the clinical trials will continue for some years to come. And that is because we need to know how long people have an antibody response or an immune response having had the vaccines. And the easiest way to do that is to follow those people who have been vaccinated as part of that trial. That doesn't mean that we need to wait till the end to be able to say, yes, this is good to use now. It just will give us information. And what we actually have now are basically millions of people around the world who've also been given these vaccines. And all of that information is feeding into our knowledge of just how good they are. So no corners were cut. It was just about streamlining and making sure that money wasn't a problem. So that's how we've managed to do it so quickly. As for what's in the vaccine, it's really, really, really simple. So basically all it is the recipe to make the spike protein for this virus, which is the thing that our bodies respond to. It's very, very fragile. So in order to deliver it to our cells, it gets wrapped in tiny little balls of fat. And those little balls of fat are a way that we deliver lots of other medicines. So that's something we know a lot about. Because we need to make sure that's the same pH as our cells, the next ingredient is salts. And then the very final ingredient is basically sugar, and that's to protect those little balls of fat when it's stored at low temperatures. So there's nothing nefarious in it, nothing that's going, nothing magnetic. It's just fat, salt, sugar, and the recipe to make a spike protein.
That's fantastic.
That is really good.
Siouxsie and Hannah, maybe our sector is part of the wider health ecosystem. So our support workers care for thousands of people in their home that have had an injury, are disabled, elderly, very, very complex health needs. And they are covered by this mandate that for health professionals. What advice do you give those that are anxious about getting the vaccine, and potentially thinking about not working in health?
Do you want to go first, Anna?
Yeah, Anna, do you want to make a comment?
I can. I mean, it's really important to get vaccinated to protect our vulnerable clients.
And
ourselves. Yeah, and themselves and their families.
I think one thing that's important to say is that we know these vaccines are really safe and effective, right? But the trials showed that basically, 90% effective. So, if you take 100 people, 96 of something % of them will make a good antibody response. The important thing we know is that there are people in our communities who will have been very safely vaccinated who haven't mounted a good immune response. And actually, there's a really, really famous example right now. If you've heard of the death of Colin Powell, is it, in the USA? So the big military person.
Yes,
he's just died. So he was fully vaccinated, but had a form of cancer that basically meant he didn't mount a good immune response. And so he died essentially of the complications of COVID-19 because he's one of those small number of people that are not able to mount a good immune response. And so the kinds of clients that you're dealing with are much more likely to fall into that category, where they may think they're protected, but actually they haven't mounted a good immune response. And that's why everyone else of us has to be vaccinated, really, in order to protect those of us in our communities who the vaccine hasn't protected, or the small number who can't be vaccinated, who are people who are basically allergic to any of the ingredients.
Right. Susie, there's a lot of differing information out in social media and on the broader web, in terms of putting a lot of fear into some of our staff. And I was wondering if you'd like to make comment on that in terms of how our people might understand where that information has come from and how true it is, or how do you verify that and what to look out for?
Yeah, it's a great question. So I guess what people need to understand is that there is a huge amount of fake and misleading information on the internet. And was a really interesting study done earlier this year that looked at Facebook and Twitter and Instagram, and got all the information that was out there on the vaccines, and then was able to say, right, is this false or misleading? Is it true? And what they showed was something like a staggering 3/4 of the information that was fake or misleading about the vaccines, they could track back to just 12 social media accounts in the USA. So these are people who for many years have had, and they've got big social media followings. They've rallied against all sorts of diseases. And the reason they do that is because they have companies associated with them that make millions of dollars by selling either alternative kind of fake cures, selling access to books or webinars. So we can call them the pandemic profiteers, because basically what they did as soon as COVID-19 appeared was they just pivoted, and they now made COVID-19 the thing that they were rallying against. And so they were creating fake and misleading information and basically putting it out on their platforms. And one of the reasons that we can't stop them is kind of because the platforms themselves won't stop them from lying, because they get a huge amount of money from the advertising revenue from having these accounts. So what we know in New Zealand, though, is that people don't like information that comes specifically from overseas. So we have people here who take that information and they repackage it so it appeals more to New Zealanders. And they are targeting people in different ways. So they'll be targeting, based on what their fears are. So they kind of package it saying, oh, are you a parent? Well, we will prey on your fears about your children. Are you somebody who might be of a, childbearing age? Well, we're going to, prey on those fears. And so I think the things to look out for, and the other thing to know, of course, about social media is that because of the way it works, the algorithms, if you click on something, it's more likely then to show you more of that stuff. So you end up with this really warped sense of what's true, because all you're bombarded with is this kind of really crazy information. So I guess the important thing is to, one of the big things they will do is they will focus a lot on your individual rights. They'll really make it about you and about protecting you. And what we have to remember about this pandemic is that actually, it's not just about us as individuals. Our choices have consequences for those around us. And what we've seen really well so far in the pandemic, and I think Super Saturday was actually a really great example of this, is just what happens when we come together to look after each other. And in your industries, that's exactly what you're all about, right? You're all about looking after each other. And so this is kind of an extra step to that.
Yes.
So I think by, people try to disrupt that by focusing us to think about ourselves and not think about the wider consequences, and they'll prey on your fears. And so just watch out for that.
Yeah, so a really great response.
Yeah, we've just had some good questions come through. I'll try and summarize some of them. Can you please explain why there is no information on whether you can transmit the virus once you are vaccinated? And then another one saying, why do we need the vaccine if it doesn't stop transmission?
Yeah, we get a lot of questions about transmission.
Yeah. So I guess this is maybe this is a bit of a misunderstanding about things, or where information, again, has been kind of repackaged in a slightly misleading way. So what we know really clearly is that if you are vaccinated, your chances of getting infected are much, much lower than if you are not. And then the knock-on effects are, your chances of getting really sick and being hospitalized and dying are much, much lower. But they're not zero, right? And again, we saw that from the trials. 90% of people are protected, but a small number of people still get infected. And it's those small number of people who get infected who are the ones who are then also infectious. But what we actually know from the data is that if you are vaccinated, you are likely to be infectious for a much shorter period of time. And that is really, really important with Delta, because every single day matters. Every day that you are shedding virus is more and more people that you can infect. And I think a really, really nice study to talk about is one that just came out from Sweden, where they looked at people, they looked at households, and basically what was the chances of somebody in that household who wasn't vaccinated testing positive if other people in the household had been vaccinated. So one of the things we have to bear in mind is that Swedish households will be smaller than ours. So they looked at basically, what was the effect of one person or two people or more than two people being vaccinated. But what they basically showed was that if one person in the house was vaccinated, the chances of the unvaccinated people getting COVID went down by 50%. If two people were vaccinated, it went down by 75%. And if more than two people were vaccinated, it went down by 90%. So wow. You, by being vaccinated, protect those around you as well. I think that's really, really clear.
Yeah. And we're hearing a lot on the media at the moment that Delta is a disease for the unvaccinated, an illness. And if you don't get vaccinated, it will find you. In particular, our vulnerable communities like the Māori and Pacifica and elderly people.
Yeah, and I think we need, another thing that people focus on is just the survival rate for COVID-19. And that actually that changes with age. So the older you are, and if you have those other vulnerabilities, then you're much more likely to have a difficult time. And Delta, it's got like twice the hospitalization rate of the earlier one. So it is a worse version of the virus to have. Yeah. But it's not just about survival. It's about the people who, like, what happens to you it's not just about death, it's about what happens to you if you survive. And a huge number of people go on to get long COVID, which is having these symptoms that last for many, many months. There are people who are still struggling now, having been infected last year. And so the impact that's going to have on people's lives, long term, impacts on your heart, impacts on your brain. Even now, the next thing that's being talked about is sexual dysfunction. So it's people who are basically turning up to their doctors because they now got erectile dysfunction or suffering premature ejaculation or things like that, having had COVID and recovered. So it's got huge long-term implications, and I guess people don't think about those much. And we haven't had huge numbers of cases in New Zealand, so we haven't seen that. But actually now we are starting to see that. And we're starting to see young people who, their lives have just basically been completely changed by being infected.
That's really great information to have. Joan, I've got a few questions.
Yeah, so in terms of just responding to the mandatory vaccination order, lots of people are asking what is going to happen. At this stage, the actual public health order is still being drafted, and we don't expect that to be released until Friday. In the interim, what we're doing is we are contacting all of you. And if you're from another employer, I'm sure your employer will also be contacting you. And we're asking you for your vaccination status. Now, you can provide that either through showing us your My COVID record, which you can very easily do through the Ministry of Health website, or you can apply for a letter. And both of those avenues will be accepted by us and by the Ministry of Health. For those of you who have been hesitant, we did a session like this last week, and we'll keep doing sessions like this. But also, we really encourage you to call and speak to your manager, or anyone that you trust. Perhaps it's your general practitioner, or it's your formatua, or it's someone who you trust, who you can get sound advice and information from. We are wanting as many people as possible to be vaccinated. It is so important for our community and to prevent unnecessary long-term complications, and in the worst case scenario, unnecessary death. And we're going to try and do whatever we can to support you. Some of you, I know I've heard from, you haven't had the opportunity to get the vaccine. You live very, in very remote areas. You've got family demands and work demands. We're working with you on an individual basis to try and support you. We're trying to give you as much information as we can to prevent large amounts of you from actually leaving the health sector.
And we want you to protect yourselves and your families and your whānau and your friends and get back to normal, because it is going to get worse before it gets better. And our sector will be looking after people with COVID in the community.
It's going to be part of our lives.
Just like we look after people with every other illness. And it is a career choice, and you're also amazing at what you do. So as Jo says, we are here to
try and help
you. And some really good question.
I just wanted to emphasize that for our sector, we've negotiated for you to be paid. I'm not sure that everybody knows that. You are paid to have the vaccine and your travel to and from getting the vaccine for both vaccines, so that you're not disadvantaged in any way. In terms of, where to from here, for those people who we can't get hold of, because some people we just simply can't get hold of, or who've said categorically that they will not get the vaccine, then we'll be having individual meetings with you and consulting with you in terms of if there are any other positions within your organisation that you can be redeployed to. We want to use you not being able to work in the health sector as our very last resort. You all deliver amazing care in the community every day. Your clients and their whānau rely on you, and we want to be able to support you and them to continue on delivering care. Any other questions, Veronica?
Yeah, there's some good ones around, and I think you've talked about the ongoing studies, but I'll just summarise. What are the long-term implications of the COVID vaccine, the Pfizer? Are there any long-term effects? And why do Maori and Pacifica, why are they more vulnerable to the virus? That's another question.
So, well, let's talk about vulnerability. We know that there are health conditions that make people more likely to have a really difficult time. And so those are things like kind of asthma, diabetes, all of those sorts of things. We've seen that in our outbreak as well, both who's getting infected, and that's partly to do with, being essential workers and where the virus ends up circulating. And it transmits really well in households, especially, and so the more people are in a household, the more people end up getting infected. So this is just a reality of the way the virus works. In terms of long-term effects, so the vast majority of things of health impacts from the virus happen in the days or weeks afterwards. And we know very well now what those are, because the vaccine has been, the clinical trials started well over a year ago. The one thing that is being watched out for that could potentially be a long-term consequence is not just to do with the vaccine, it's to do with the infection itself. And it comes from something that we know about dengue virus. So people who get infected with dengue virus, they will make some antibodies. If they survive that infection, they'll make antibodies. And the antibodies are the amazing protective thing that neutralize the virus the next time that you see it. And what happens in some people with dengue is that their antibody levels drop over time, to the extent that they're so low that if they encounter dengue again, the low levels of antibodies, instead of protecting them, actually help dengue virus get into their cells. So that's the thing that is being watched for. What we don't want is for people to have low levels of antibodies that if they then encounter COVID, end up making them sick. So it's something that's being watched for. There's no indication it's happening. We'd actually start to see it already in terms of the infection, because we've had people, who've been in, were infected well over a year ago now, 18 months ago. We're seeing no sign of that. There's been no sign of it in the animal studies, but actually also there's been attempts to make vaccines against other coronaviruses in the past. So there's a coronavirus that is called MERS, and then the other one called SARS. And so we've learned from those actually about how to make vaccines that don't cause this effect, which is called antibody-dependent enhancement. So that's the thing that's being watched for, but there's absolutely no sign that it's happening. What we do know is that the consequences of COVID itself, the long-term impacts from that, are likely to be huge. And we're seeing already sort of just short-term stuff, but in terms of impacts on fertility, impacts on on long-term quality of life, dementia risk, probably all these sorts of things are going to be massive with COVID-19. So it's about weighing up the risks. And the thing that's working against us here is that humans have got two really bad character traits. One is we tend to think things won't happen to us as opposed to other people. And the other is that we focus on the risk of things. We put our understanding of risk in the wrong place. So people somehow have become not frightened of COVID and think the unknowns about the vaccine are the things to be frightened of. And it's actually the other way around. So I can understand why people have these concerns. It's the way our brains are wired. And we sort of have to actively work against our brains to say, actually, do you know what? COVID is the thing that I don't want to get. And there's a really good way to protect myself from that, and it's to get vaccinated. Because our brains are kind of trying to work against us, and then they're being fed by all this misinformation that's kind of, as I say, preying on those things that we're worried about.
So just on that, all the thousands of people that may be reading the wrong things or signing up to the wrong algorithms on Facebook or TikTok, where would you suggest is the safest, most honest information in New Zealand? Would it be the Ministry of Health website in terms of what the vaccine program is and
what it's made of?
Yeah, I mean, if you don't trust them, so I'm completely independent, and I write about all this stuff on the spin-off. So I try and read all the studies and write about what they're showing us, both the good and the bad. But in terms of, so another place would be the Immunization Advisory Centre's website. Again, they're kind of independent, but charged with looking at all this stuff. And one of the things I do want to mention is that there's a massive project called the Global Vaccine Data Network that is tracking something like 230 million people in 17 different countries. So these are people who, after they get vaccinated, they get kind of randomly enrolled in the study. They then get a little message saying, do you mind answering some questions? And then they will be followed up over time. Can you tell us about what what side effects you've experienced, all those kinds of things? And it's really important that they're being done on this scale in different countries to find out what's happening in different countries. So these studies are being done, and there's, as I say, there's millions of people. So every day there's new studies coming out looking at what are the impacts and comparing those impacts of vaccination with the impacts of COVID-19.
But really, I think a good point to end on. I think we've got 1 minute. We want to extend a very warm and sincere thank you to you, Siouxsie, and to Hannah for joining us. I know it is a very challenging and confusing time for all of our people, and I guess what we're trying to do is support you to make the right decision, and the right decision is to get vaccinated for you and your whānau. So thank you once again, and thank you to the hundreds of people that joined, and we'll look forward to, I'm sure, seeing you again on here in the near future.
Thank you
Thanks
so much. Take
Thanks,
care.
Siouxsie.
Bye.
Thanks.